Hey guys, if you or a loved one have been diagnosed with a bone, joint, ligament, tendon, muscle, or nerve problem, orthopedic condition, you've been told you have osteoarthritis, perhaps today's information could change your life.
You're looking at a few hundred cells here that are working together.
The heart muscle cells that Dr. Tim Nelson views highlight recent advances into regenerative medicine.
The simplest way to explain that is it's the opposite of degeneration.
Tissues in your joints and other areas can degenerate or break down with time or disease. Regeneration is the renewal of those tissues, which is something the body does naturally.
So one strategy is to try to find ways to improve the healing of your body, and another strategy is to actually supplement or augment the stem cells in your body so that we can improve the healing by transplanting stem cells into it.
Dr. Nelson and his colleague Dr. Andre Terzik use stem cells in their research because stem cells are responsible for growing new tissue.
So stem cells just means that they're seeds that can grow into many, many tissues.
Stem cells can come from a variety of places. Here's how it works. Cells called fibroblasts are removed from a patient's skin. They're reprogrammed into what are called pluripotent stem cells. Those cells can be taught to become any type of healthy cells, such as these heart muscle cells. The idea is that the newly engineered healthy cells, when introduced, will help restore or regenerate the function of the unhealthy cell.
This is one cell that's contracting, is working with many cells, and that gives the whole tissue the contraction pattern like a normal heart.
It becomes much more real when you have a personal connection to a disease or an illness where we don't currently have good options. And this is where people are asking more and more of the questions, what about stem cells?
The answer is researchers such as these at Mayo Clinic push forward to make regenerative medicine a reality for patients searching for successful treatment and perhaps cures. For Mayo Clinic News Network, I'm Vivian Williams.
Hey guys, I'm Dr. Emmett Blahnik, founder of Next Level Health Cooperative, and my purpose is to help you get to the next level with your health, happiness, and lifestyle. Today we're going to be speaking about regenerative medicine and that sexy, sassy word, stem cells, exosomes, hyaluronic acid. The National Institutes of Health defines regenerative medicine as the process of replacing, engineering, or regenerating human cells, tissues, or organs to restore or establish normal function. I want to talk to you about that word function because it is a crucial part in understanding how we're going to get you to the next level. See, the definition of health is a state of optimal function and healing of the body, not merely the absence of symptoms. And what I mean by that is this. Typically when I ask somebody, how do you know if you're healthy? You typically would base it on what? How you feel. Yeah, most people base their health on how they feel, despite the fact that the top killers today in the United States, heart disease, cardiovascular issues, even cancer, strokes, these things are referred to as silent killers. So we don't just base your health on how you feel, but rather how you're functioning and healing. So to be healing at 100%, you got to be functioning at 100%. But when you're less than 100% function, what that means is it's malfunction. And what you're really doing is you're degenerating. When do you know when you're degenerating? Because if you can't necessarily feel some of these silent diseases, when would you know? Often, not until it's too late. See, symptoms are typically the last thing to show up. They've proven that you could literally have up to 40% damage to some part or area of your body. Your knee, your back, your spine, your neck, your heart, and you could feel fine. There's no symptoms. That's where you hear stories where somebody doesn't even know they have cardiovascular disease and then they drop dead of a heart attack. So we don't just base health on how we're feeling, but rather we want to optimize your body's ability to function and heal. And we're going to show you step by step how we're going to do that with you and with regenerative medicine. So regenerative means, by definition, to bring into existence again. So in our clinics we use regenerative medicine products, including things like platelet-rich plasma. I may refer to that as PRP, just so you know. We also use things like exosomes, that sexy, sassy word that a lot of people are familiar with is stem cells, hyaluronic acid, growth factors, fibrinogen, and protocols designed, tested, and researched to restore your injured area and painful area to as close to normal as possible. See, I'm not only the owner and founder, I'm also a client. I too have been using regenerative medicine and platelet-rich plasma, stem cells and exosomes and hyaluronic acid to get my body where I want it to be. Now that I'm 45 plus years old, I want to be able to be doing push-ups and not pushing a walker as I get through my midlife. I've been sidelined with things that I love to do in my life. I like to go running. My occupation, I'm bent over a lot working on patients, and my lower spine, my sacroiliac joint, my hip, and my calf and my knees and my thoracic spine have really been taking a beating, so I've had to discontinue doing triathlons, Ironmans, the things that I love to do, until now. I no longer have pain in my low spine and my hip. My thoracic facet syndrome has improved dramatically, and my calf muscle, which I recently tore my calf muscle recently. I'm back running within 2 days, and I'm not necessarily saying that's gonna be for you, but that's my experience. I have this youthful energy that people have tried to explain to me when they've received regenerative medicine and exosomes and stem cells. Some people have described it as the fountain of youth, and I didn't know if I really bought into that, but I can tell you this, it is anti-aging in nature, I believe, and it has given me this surge of power and energy that I can distinguish quite uniquely as I just feel more youthful. So I'm not just somebody that helps people with regenerative medicine, I too utilize it as an anti-aging protocol. So with regenerative medicine procedures, you can not only eliminate your pain or minimize it, but also repair, rebuild, and heal your problem area.
We choose to do it, not because it's easy, but because it's hard. Our vision is within a decade, the trajectory of health will change.
Medicine is moving at such a fast pace right now.
Everything in medicine that we know now is going to change. Surgery, pharmaceuticals, well, now we're in the age of cells.
Cells will represent to doctors a much safer and more effective and sustainable way to treat all diseases that involve degeneration of tissue. So that's just about everything.
Exosomes will be very important in regenerative medicine because very similar to stem cells, they regenerate. They like to fix things.
That's what they do. They signal your tissues in your body to heal thyself.
Cell therapy, stem cells, immuno-oncology using other cells of our immune system, natural killer cells, T cells, and then gene therapy.
What interested you about stem cells?
Oh, the technology is incredible. 15 years ago, I would have said this is science fiction stuff, and it's with us right now.
In vitro fertilization was considered a wacky idea. Now it's something that we use every day and we take it for granted. Soon we'll see the same thing with stem cell therapies.
It's a giant shift in thinking, in the concept of being a physician and a healer. And you can never just go back and say, I'm going to go back to my old life. I'll do surgeries and I'll write prescriptions. I can never do that again. I've already seen the other side.
5 years from now, majority of illnesses will be treated by stem cell, and any medical doctor coming out of any medical school must learn stem cell, otherwise they'll be left behind, period. We are a part of creating history.
And so what I want you to do is I want you to imagine just like a cavity in your tooth. So you have some pain in your tooth, and so by the time you went to your dentist with the pain in your tooth, what would the dentist tell you you already have? You already have decay or damage. And so often we'll get asked, well, how much does it cost? Well, I would encourage you to pick up your phone, call your dentist and say, hey, how much does it cost? He's going to start asking you questions like, what are we dealing with here? Well, it's pain in my tooth. He's going to have to say, well, or they're going to say, well, I'm going to have to take a look, and we're going to have a consult, and that's what we're going to have to do with you. So if you're looking for some more guidance in terms of cost and care plans and protocols, well, that's like the dentist saying, hey, I haven't even seen your tooth, I haven't even met you, so why don't you come on in, we'll take a look around, open your mouth, maybe take some x-rays, and then I'll be able to determine, is it a cavity, is it a root canal we're talking about, maybe a cap, but there's a number of variables that would go into that decision-making process, and that's what this is for you. So whether it's you and your significant other, your spouse, I would encourage both of you to be participating in the understanding and educational side of that, as well as how we're going to be able to help you and how we can help you afford the care that you may need. So I wanted to ask you, what do you think all these species have in common here? So in the Midwest, where my family's from, they go hunting, and I would see those 10-point, 12-point bucks, and I would think, wow, they must be really old. And in fact, what I learned was that every year they regrow that tissue, they regrow their antlers every single year. So I used to think that the ones with the bigger horns and the bigger antlers, they were just older, and in fact what they're doing is they're regenerating. The same with the starfish. If you cut one of the stars off, or the lizard, or there's a species referred to as the axolotl that's really giving us some promising hope in the area of regenerative medicine, particularly stem cells.
Probably the most interesting thing about them is their intense ability to regenerate. Not only can they perfectly and seemingly endlessly regenerate limbs, but they can also regenerate their spinal cord, jaw, tail, and skin, all without scarring. No matter how many times you cut off their limbs, they'll grow back perfectly. You could also even cut out a chunk of their spine, come back in a month and a half, and they'll be no worse for wear. They are also 1,000 times more resistant to cancer than any other animal. It works like this. After the amputation, the cells at the site of the amputation lose their identity. So instead of being skin cells or blood cells, they become similar to stem cells, called pluripotent cells. And they're able to make any cell or tissue that the body would need to repair itself. In this case, they use the pluripotent cells to generate all the cells and tissues needed to create new, perfect limbs. This phenomenon is a favorite among the scientific community for its potential to help burn victims, amputees, and even cancer victims.
So for example, the lizard, it can lose its tail, and what happens to the tail? It can grow back, which is pretty amazing. This is what we mean, or the concept that I want you to have as you think about regenerative medicine. That is what we mean when we say regeneration. So I really want you to just have that concept in mind. What we're talking about is that regrowth of tissue that maybe wasn't there and bringing it back into existence. So what's amazing is that regenerative medicine and exosomes and stem cells, although it's a hot popular words right now, it is not a new science, it's an emerging field, and we can now bring it to you here locally. So I'm excited because schools and universities are not just studying it, they're implementing it with their patients. So everything from the Mayo Clinic to Harvard, Stanford, the list goes on in the United States and around the world. And in fact, we're really trying to catch up to some of the pioneering studies that are done throughout the world. I've actually sent patients to other countries to get the types of services and care they needed because maybe we couldn't do it here in the United States until now, which is great. It's exciting. So we look forward to working with you here shortly. So what is degenerative disease? Well, to degenerate means the death, decay, and wasting away, most often silently. Yeah, the majority of illness today are referred to as silent disease or silent killers. So you always have choices in life. And by the time you get to an office like ours or a clinic like ours, you've probably already talked to your medical doctor. This probably is not your first option or first opinion. So I want to be your second and third opinion here, but here's the bottom line. You've already talked to your family doctor. You've already talked to your medical doctor, I'm assuming, or your physical therapist, or your chiropractor, your massage therapist, your acupuncturist, your personal trainer, whoever that is, your nutritionist, your dietitian, and here you are. So if you're satisfied and happy with the results you have, I would just say continue to do what you're doing. But if you're looking for a better option, you're looking for another opinion, perhaps you haven't tried this before, then you're in the right place. But if you keep doing what you're doing, you keep getting the same results. But I'm going to come back around to the fact that I believe you've probably already talked to your medical doctor. And often, one of the most common questions and common sentiments we get is, why hasn't my doctor talked to me about this? Why hasn't my doctor told me some of this stuff? That's a great question, but we want to be your doctor. We want to be your champion. So many people are suffering and debilitated with chronic joint pain, knee pain, hip pain, shoulder pain, elbow pain, wrist, ankles, feet, arthritic conditions, degenerative joint disease. The purpose of this video is to educate and empower you and introduce you to a new solution, an alternative to the conventional ways of care for some of these chronic joint pains and chronic conditions.
All right, Gary, I was just overhearing you talking about some of the results you've had with regenerative medicine. Can you give us some changes that you've experienced, what you were just sharing in the back there?
Well, I've had low back pain for a number of years. I can't even remember how long ago I've had it. It had gotten worse lately. And then we heard about this, so I thought I'd give it a try. I've got nothing to lose because it had pain. If it makes it better, great. If it doesn't, well, nothing lost, nothing gained. I came in, had the shots taken. I had the 2 shots in my lower spine. And I was immediately thinking it was just placebo effect because I felt better right away. And I figured that was just the placebo effect of it because expecting it to feel better, it's going to feel better. But it has not gotten, in fact, my back has gotten better. It's just I have very little pain. The pain that I had before, I still have some pain, but it's a different kind of pain. But this time for the low back pain, it was just amazing. It's gone. I can bend, stand, other than my knee, most everything I ever used to do.
Maybe your next place of regenerative medicine.
It's not going to work there because it's artificial.
Okay, so tell me, if you're talking to somebody about it who's skeptical, what would you share with somebody who's just a little nervous about doing it?
I was talking to a friend of mine who has back problem also and has been going to get regular shots in his back for it. And I said, this is great. It worked fantastic. It's like from day one, there was no problems that I've had with it. I don't let pain limit me. I just work through it and do whatever I have to do, and it just grunt and groan and ache. But now, usually it was like standing up. Standing up's still pain because I have an artificial knee and it's always a pain. But it would be really bad because I'd lean forward and it would hurt just to lean forward. Mm-hmm. But then standing up, that pain would radiate in the back and now it's gone. The only pain I have now is just my knee pain. And that's, like I say, that's because it's an artificial knee. And
right.
So
awesome. Well, appreciate it. We hope this helps somebody with their health journey also.
I hope so too, because like I say, I was kind of skeptical. I have a degree in public health, so I know what's fishy and what's not fishy.
Yeah.
And so I did my research ahead of time just to make sure. And I went in was thinking nothing to lose.
Yes.
And it worked.
And everything to gain.
It worked.
Awesome. Thanks, Gary.
It's the worst knowing that people are suffering, and the most common options, which should be the last resort, has now become the first resort. So what are the options for pain for people today? Typically when you go in and you go to your doctor, it's pills, it's more pills, shots, or surgery. And we now know that prescription pain pills or painkillers are now one of the leading causes of death today in the United States. We want to avoid them at all costs and only use them in a crisis situation. But opioids have become a crisis itself which we now know kill over 200 people per day, according to the authorities in that area. So what we want to do is give you a safer, more effective solution, one that's now in an emerging field called regenerative medicine. So stay tuned. Imagine being told that you have an arthritic condition, a degenerative disease, a degenerative condition, but the conventional options you may be trying, something like physical therapy. Have you tried that before? Rehab, obviously also painful. You've been told, worse, where you've been told that we're just going to watch it get worse because, hey, the surgeon says, remember, the surgeon says that when it gets bad enough, we can replace it. Just think about that. There's roughly a 4% chance of death due to complications from knee replacements. So they're just going to watch it get worse until now. Now we can intervene, and early intervention is the best intervention. So my goal is always to help people. I want you to have a long, happy, healthy life, not addicted to pills. We want you to be thriving, not just surviving in life. We want you on the cruise ship, not in the nursing home. We want you to be doing push-ups, not pushing a walker. And because of regenerative medicine, we're seeing people kick the cane to the curb. We're seeing people get up out of their wheelchairs, out of their scooters, enjoying and thriving in life again, and that can be you. So here's a perfectly normal, healthy apple, and it's been dented, so it got a dent in there, and what it's now doing is the apple is essentially decaying and wasting away. So that would be much like the decay and degeneration of your knee joint, for instance. So this is the progressive degenerative disease of what osteoarthritis does to the knee, to the point where it could be bone on bone. Here's another example of how the spine, the vertebra, you have these nice cushions between the spine, and it's degenerating. So we actually categorize whether it's your knee, your shoulder, your hip joints. We begin to categorize them in the severity of the phases. So you could be in a phase 1, a phase 2, or phase 3 in terms of the severity. And the severity ranks from mild to moderate to severe, where severe would be kind of that bone on bone, so to speak. And often I've heard people reference whether it's their knee or their shoulder or their hip, say, my doctor said it's bone on bone. And that's why we don't like to guess. What we want to do is we want to test. We would actually look closer to your imaging studies. So what we would do is we would actually be taking your x-rays, your imaging studies, your MRIs, and taking a look at them to see, in fact, if they are, in fact, bone on bone. Because if it's not, if there's room for hope, we want to be hope dealers, not dope dealers. If we have, where there's any opportunity to begin that regenerative repair healing process, now we have some hope and we have some areas to grow. And what I have noticed over the years, I've been in clinical practice for over 13 years. Maybe the practitioner or the doctor just was not being clear or maybe even accurate with you. The majority of the time, when somebody says it's bone on bone, in fact, what we begin to learn is it's not, which means there is hope that we could possibly avoid that replacement or surgery now with this area of medicine called regenerative medicine. Symptoms. You know, I want you to consider your symptoms like a check engine light on your car. Don't ignore your body's warning signs. You know, the majority of people, what they do is, you know, they go into the doctor because they have some discomfort or pain, and then let's say, you know, you have the knee ache or the hip ache. You know, what do most people do for that? Whether it's the ibuprofen, the Aleve, the acetaminophen, the Advil. You know, so what that is doing is just masking the pain. It's not necessarily addressing or correcting, number one, what's causing it, the source of it, and then they're not removing what's causing it, and they're just kind of masking the symptoms. So I kind of think of that like, you know, the check engine light on your car. So if your check engine light went on, you want to be paying attention to that, and you don't want to just put duct tape over the check engine light. But that's really what has happened and gotten us into this crisis of healthcare, which is we're palliating symptoms by pain pills and over-the-counter medications, even cortisone shots. That's kind of like putting duct tape over the check engine light. It can get worse. It will get worse. It will progress, kind of like that apple or the degenerative spinal condition. You may not feel it getting worse, which guess what you need more of then? You need to up the dose. You need to up the power of the pain pills or the shots, and that, obviously that comes with some consequences. So let's take a look at some of the orthopedic conditions that we see tremendous success with regenerative medicine. If you have a knee condition, osteoarthritis of your knee, a frozen shoulder or a shoulder condition, a hip condition, an ankle or a foot, toe problem, plantar fasciitis even, elbow conditions, a tendinitis, a tennis elbow or golfer's or a golfer's elbow, a spinal condition, your back, you have a back condition, a lumbar degenerative disc disease, a thoracic condition, or a cervical spine, a neck condition. So how many of you have a neck condition or something radiating into your shoulders or into your elbows or into your hands, even carpal tunnel-like of syndromes? Problems with your hands. I've seen people with arthritis to the point where they can't even, close their hands. In fact, I was at the University of Tampa Medical Center working with a patient with regenerative medicine, and his knuckles and his fingers were so thick. I mean, they looked like golf balls. So the first time that he went in for treatment, he couldn't really even bend his hand, but by the time we saw him on that second time, he had the ability to move his hands, and that was with regenerative medicine and PRP, which is platelet-rich plasma, which we're going to get into. It's not too often that people relate their spinal problems and spinal conditions with their organ problems or reproductive organ problems. So let's just take, for example, this example of that lumbar or low spine. You're actually looking at a side view of the low spine. I mean, this spine is just horrific. It's degenerating. It's getting to that point where there will be some surgical intervention, and here's why. Because the nerves that come from your spine, the nerves that control the ability to wiggle your fingers and your toes, well, they also reach out to all your organs. So that power that God put in your brain is traveling through your nervous system, and it branches out through the nerves to reach to every organ. So for your heart to beat and your lungs to breathe, for you to see and hear me, or for you to grab things or use your legs, for your reproductive organs to work, your digestive system, your gallbladder, your appendix, for all of your organs to work, the nerves that exit your spine, your spinal cord, they control the functions of those. So if you just think about, like, if you were to cut a nerve, let's say you were to cut a nerve in half going to your eyeball, what would that do to your vision? Well, that would be the same for your organs in your low spine. So if you cut a nerve in half that controlled the functions of your reproductive organs, those organs wouldn't work. But it's very rare people relate that spinal degenerative disease to their erectile dysfunction or their reproductive organ function or their ovarian malfunction or their hormonal imbalance. But those nerves control all of those functions, and if you're choking, damaging, and destroying those nerves, you're going to destroy the health and the function and longevity, the quality of life of the organs that go along with that. So if I can show you today a way to get rid of your problems, and here's the key question is, if I can make it affordable for you and your budget, do you want help? Okay, so let's look at some options, some solutions to the problems that you have. Keep in mind, we don't fix, we don't heal, and we don't cure. You know who heals? You heal. The power that God put in your body to heal, similar to the idea that if you break your leg or you cut your arm, You have this amazing power in your body to heal a cut, even a broken bone. And thank God we have the doctors and nurses to set the bone and put it in the cast. But the healing power comes from within you, and that's what we're harnessing, is that healing power, and we're accelerating that potential in your body. So for regeneration to occur, for healing to occur, the body needs cells that have the ability to rebuild the injured area. So remember, regenerative medicine, according to the National Institutes of Health, is the process of replacing, engineering, or regenerating human cells, tissues, or organs to restore or establish normal function. In our clinics, we primarily use a couple of different versions of regenerative medicine. We use platelet-rich plasma injections, which I may or may not refer to as PRP, so platelet-rich plasma. We also use MSC injections, which is often referred to as mesenchymal stem cells, which is now kind of more referred to as mesenchymal signaling cells, not stem cells. Hyaluronic acid, exosomes, growth factors, there's a number of different things within those injectables, but our goal today is to give you the information you need to move forward and get you healing and repairing as quickly as possible. So let's go into what platelet-rich plasma is.
PRP is a next-generation, non-surgical, minimally invasive treatment that uses the body's own ability to heal, repair, and grow tissue. Your body uses free circulating stem cells within the blood along with growth and healing factors to fix your area of pain or injury. Stem cells and platelet-secreting growth factors are the injury-fixing superheroes of your body. They are called to your area of pain or injury by the plasma that is rich with platelets or PRP. The PRP not only calls the stem cells to the scene, but also gives them extra super healing powers, which speeds up and aids in recovery. Generating PRP is a simple process. A health professional draws a small amount of blood from the patient. It is then put into a centrifuge and spun for a short period of time, and then activated with a special proprietary solution from Juventix. The drawn blood is spun until the plasma inside the vial has 3 to 6 times the number of platelets than normal plasma. The health professional then extracts out the separated PRP and injects it into the affected area. This is how Dr. Michael McMahon, MD, explains the benefits of PRP. PRP concentrates regenerative properties found in the patient's body. The PRP is injected right at the site of the injury. The PRP goes to work, starting the healing process immediately. There is very little risk of the body rejecting the treatment or having side effects or infections, because the entire treatment is using the PRP generated right from the patient's own body. Here is what Dr. Brant Koning, DC, said about the success he had with PRP. The results I got were incredible. I had an injury to my left elbow that I thought was going to need surgery. After the first treatment, my pain was mostly gone. After the second treatment, I realized that I would not need surgery. It has been 4 years since my PRP treatments, and my elbow is still pain-free. Thank you for watching this video.
So with our PRP, it typically contains about 8 times the concentration of normal platelet levels. So when isolated on its own, blood plasma is a light yellow liquid, similar to the color that I kind of refer to it as honey. Plasma is rich with water and carries valuable healing enzymes and other nutrients that are needed for healing. The primary purpose of plasma is to transport nutrients, hormones, and proteins to the parts of the body that need it. PRP contains several growth factors and other cytokines that can stimulate healing of soft tissues such as muscles, ligaments, and tendons. We really like to use this for more of soft tissue use than anything. The itises, the tendinitises, the plantar fasciitis, and so forth. But some common uses for PRP therapy. Remember, the process has been shown to be safe and effective in treating the most common conditions such as osteoarthritis of the knee, shoulder, hip, and spine, rotator cuff strains and tears, anterior cruciate ligaments, and even posterior cruciate ligament tears, pelvic pain and instability, back and neck injuries or pain, a whiplash type of syndrome where you actually tear muscles and ligaments ligaments and tendons of the neck from maybe a car accident, your tennis elbow or golfer's elbow, tendinitis and ligament sprains, chronic knee pains and muscle conditions. So this is perfect, for somebody actually using their body on a regular basis. One thing you might be asking yourself is, am I a candidate for PRP? Well, has your condition lasted for more than 3 months or longer? And I love that word regenerative therapy, because remember, regeneration means to bring into or regrow tissue, which is something we've really been striving for in health and healthcare, and we finally have that available for you now.
If you're watching this video, you're probably among millions of people who needlessly suffer from knee pain, elbow pain, foot pain, shoulder pain, peripheral neuropathy, joint pain from arthritis, and many other conditions. Unfortunately, those who suffer from these problems have had virtually no options to relieve or fix these issues. Many people try over-the-counter pain relievers and expensive prescription medicines that do not fix the problem and may only offer some temporary relief with sometimes devastating side effects. Some people are recommended surgeries that are risky, expensive, painful, and may or may not fix the issue. Even worse, some are told by their doctors there is nothing that can be done and are left to suffer every day without any good options. The good news is, there is a growing field in healthcare called regenerative medicine. Regenerative medicine has already been responsible for helping hundreds of thousands of patients with these types of conditions while preventing countless numbers of surgeries. Regenerative medicine is the rapidly advancing area of medicine that has the ability in many cases to help repair injured and damaged tissue in the body that was not possible before. The types of regenerative medicine used in this office are regenerative tissue such as umbilical cord tissue, umbilical cord blood, amniotic fluid, and amniotic membrane. These types of regenerative tissues are a next-generation, non-surgical, minimally invasive treatment that uses the human body's own ability to heal, repair, and regrow tissue. Regenerative medicine brings hope and possibilities that were not available before. That's right, finally, there is hope to actually fix your problem. We do this by using the healing and growth components along with mesenchymal stem cells that helped you develop and heal from when you were born until fully matured. These same components that helped you develop, grow, and heal are found in the regenerative tissues we use. Mesenchymal stem cells are your body's master cells. The reason why they are sometimes called master cells is because mesenchymal stem cells are multipotent. What multipotent means is that these types of stem cells can develop into more than one cell type. So if you have a joint problem, they can become joint cells and fix your joint. If you have a tendon problem, they can become tendon cells and fix your tendon, as well as cartilage, muscle, ligament, or other types of cells needed to fix your area of pain or injury. One of the reasons your body may not be repairing itself is, as we age, the number of mesenchymal stem cells in our body decreases. When we are born, we have around one of these mesenchymal stem cells for every 10,000 cells. As we get older, the percentage of mesenchymal stem cells to other cells decreases. As percentages decrease, it gets harder and harder for your body to repair itself. It is harder because mesenchymal stem cells are what help our body repair injuries. If we have less mesenchymal stem cells, then we have less healing potential. This may be why your body does not heal or respond to treatments the way it did when you were younger. When you get to be age 50, your ratio could be as low as 400,000 cells to every one mesenchymal stem cell. That is a 40-to-1 decrease, meaning your body has 40 times less healing potential as it did when you were born. At age 80, it could be 2 million cells to every one mesenchymal stem cell. That means 200 times less healing potential than when you were born. The procedure is simple. Our medical professional will inject the regenerative tissues right into your area of pain or injury. The mesenchymal stem cells, as well as the other healing and growth factors injected, are as powerful and concentrated as they were when you were a child. This helps give you back the healing and repair power of your youth. Stop suffering. Be able to do things you have not done in years. Live again with little or no pain. There's now a better option. Thank you.
So another great example would be this. So we're going to take that and we're going to use all of these little examples. So we have a miniature baseball, a miniature soccer ball, and a miniature basketball. So those regenerative cells, cell therapy, let's say that the baseball is like your shoulder cartilage and the soccer ball is something going on with your spine, and the basketball is your knee, meniscus, or cartilage. And so those regenerative cells, that tissue, when it's injected, it has the potential to become or assimilate into one of the elements that you want it to become. So for instance, if it was introduced, as you saw in that video, to the heart, it assimilates, kind of almost like, you can think of it like a chameleon. So this is the way it kind of helped me understand it a little bit better, is that it can kind of become and act like, and then regrow into those heart cells. So we're going to focus on the basketball. We want it to become the knee. So if you're struggling with osteoarthritis of the knee, we want it to assimilate and become a healthier knee cartilage. And so in essence, what it will do is it will then become what it is injected to, so that we are regrowing the tissue that you actually want it to become. So this is kind of the example that, I like to think of it as, and so hopefully that helps you. See if we can juggle. So as is explained, when stem cells come to the area, they can turn into that new tissue that's trying to be repaired. They can also instruct. That's why they also often refer to them as not just mesenchymal stem cells, but mesenchymal signaling cells. They can also instruct all other cells on what to do. They become like a foreman. But again, keep in mind, it assimilates into whatever it's injected to. So whether it's the knee, meniscus, or cartilage, it's the shoulder, labrum, it's the hip cartilage around there, whether we're injecting that hyaluronic acid, the exosomes, stem cells, growth factors, it can assimilate and become the tissue that you're attempting to regrow. So growing the pea into the pumpkin, growing the mini basketball into the cells and tissues that it should become. So hopefully this has been helpful for you. I look forward to working with you soon. So this transplanted tissue, this is actually a picture of me getting it done in one of our labs. The transplanted tissue helps your body with reduction and elimination of pain. It reduces your inflammation. It minimizes scar tissue, promotes soft tissue growth, regenerating new bone, cartilage, muscle, ligaments, and even nerve growth. In orthopedic conditions, we're just seeing phenomenal results, and we want to aggregate our outcomes. So I want you to be part of this study, the same as me. So let's take a look at a couple of amazing results and some amazing options. Now, it is important for me to say that not everybody gets the same results, and I'm going to kind of go into some distinction as to why I think that is. Here's the bottom line. If you kind of think of where you're at today, you can either get worse or you can improve. Remember the apples, or remember spinal degenerative disease or osteoarthritis. A cavity always works to get worse, right? So just keep in mind, if you do nothing, things will get worse. They do not remain the same. Now, you may take medications or take some shots to feel better, but it doesn't mean that the decay progression is stopping. You're either going in one of two directions. It's either getting worse or it's improving. So what I want you to do is just consider where you're at today. And let's say that, hey, if you were to get 50 to 100% improvement, what would that look like? Or take where you're at today, and if you were beginning to get worse, 50 or less. So here's what I think, here's what I see as the reasons where you can find somebody that has gone out and maybe gotten some shots or injections of stem cells or hyaluronic acid, and it wasn't successful. They said there was no results. Well, here's what I see kind of the difference maker in as we work with clinics throughout the country as part of our clinical trials, is one thing that I see is that people that just go in there and just maybe get an injection in their knee or their hip or their shoulder and don't alter or do anything else that's when you're kind of going 50-50 there. Will it work or will it not? Because if you kind of keep doing to your body what got you where you're at, you're probably not going to have great results. So that's where it's kind of like a coin flip, whether it's going to work or it's not going to work. So our goal is to get you 70 to 90% improvement as a minimum with our gold standards of care, which means it's not you just come in and get injected. You can do that, but what we want to do is apply our resources and services to get the best results, which means this. There's going to be some possible pre-care if we determine together that you're the right fit and we're the right provider for you. There's going to be perhaps some pre-care. So this is really what moves the needle and gets the best results, is when you have, it's kind of like surgery. You have some pre-op, and then we're going to administer your tissues there, your cells, your allograft. We're going to administer your injections, and then there's some post things. So it's like post-op, some post-care. So one of the things that we use might be a knee brace. If there's some bracing that might need to be done, we'll fit you for that. We also have some advanced vibration therapies for the knee or the shoulder, the spinal conditions, decompression. So we may have to do some decompression therapy in one of these areas of your body. And so some of the most advanced and cutting edge technologies that we use here, you will not find the types of stuff that we do here anywhere else. So even though you might get something cheaper somewhere else, the outcomes in terms of the types of care that we provide here, you will not find anywhere else. And one of the reasons is that the FDA highly regulates, which I think is a good idea. I think it's necessary. They scrutinize trials, and we are part of that. So we are part of clinical trials with the companies and the tissue banks that we work with that we're going to be getting into. So if you're becoming a client, you would also be part of a clinical study so that we can continue to monitor the progress of patients along the way and their success, some of their outcomes, and then you would be participating in that study. Your information in terms of your identity and name or anything wouldn't be given out to anybody, but I do want you to know that you're part of a more comprehensive approach to this area of regenerative medicine. And I do believe in the FDA and the FTC highly regulating and scrutinizing it, because there are some mom and pop shops out there that might be doing some not so hot things, that you might be getting products that are not exactly what they were intended to be. But I would encourage you to not just go to some mom and pop shop just because it's the cheapest service. We want to get you the quality of care and an affordable opportunity, an affordable rate. So we want to get the best results. We want to get you the best results, which means we only work with the people that are compliant with the message, the procedures, and the quality of care that we're looking for our patients, so you can be part of a trusted provider. So I also know this, that a lot of people, one of their main questions is, does insurance cover it, and can I afford it? My answer is this: yes, you can afford it. We have an affordable payment option. I don't necessarily think it's cheap, but we definitely make it affordable. So we don't let finances be the barrier to you getting the care that you deserve and that you need. So we do have payment plans and payment options affordable for most budgets, but you want to think of it this way: if you had to finance or pay for the cost of braces or orthodontics, sometimes that's considered an elective procedure. And so if you had to pay for that type of care, that's really what we're looking at here, and we do have financing options available for you if you want to move forward with us and you want our help. So one of the main questions we get asked is, how long does it take to begin to see results? I'll tell you this from my experience. When I got it, I've had that low spinal condition, sacroiliac joint and lumbar facet syndrome, for a decade. And I would say relatively a week to 2 weeks into it, I do not feel it at all. So that was for me. So it took me roughly about 2 weeks. In my thoracics, I would say it's about 60 to 70% improvement, and that would be after 3 weeks. The question is does insurance cover this type of care? Insurance does not yet cover all of these methods, but remember, our policy, we will never let money be a barrier from you getting the help you need. We have affordable financing options available if it's important to you and you want to move forward, but I would encourage you to consider like the value or what it would look like to have to pay for braces. You know, braces don't correct your teeth overnight. They are an elective investment most often, and so often, whether it's Medicare or some of the other insurance providers, they look at this stuff as more elective, and here's a good example of why. So we do have 0% financing options if you qualify for that, and if not, we also have other affordable payment options, and we'll go through the thing that's the right fit for you. But of course, it's not free. We don't give it away, but we will get you into a affordable financing option that's right for your budget. So our goal is to get you out of pain, get you back functioning closer to, if not back to, normal. We want to stop the progression of degeneration. You want to stop that degenerative disease. Remember, it'll continue to progress despite the fact that you might cover it up with duct tape or those pain pills, the over-the-counter medications, or worse, even the shots that actually deteriorate joints and make them worse over a long period of times. And that's why they say you can only really have 3 cortisone shots during a lifetime in a particular part of your body. We want to help you regenerate and get back the quality of life that you are here for. So our goal in regenerative medicine is to get you to that 70 to 90% improvement, which means the best way to do that is to get some pre-care, and then we have the days or day that you do your administration of regenerative medicine, and then we have post-care. That gives you the most favorable outcomes. But again, if you don't alter anything in your life and you just go and get the injection, that's where you could see where it's kind of a 50-50 coin toss of results there. So I want to walk you through our core 4 regenerative medicine. And step number 1 is to remove the source or the cause. So that might also include some things like we might need to brace a knee or a shoulder or a hip. So we're going to remove what's causing it in the first place or what caused it. We also want to remove sources of exogenous inflammations. Step number 2, we want to repair the tissue, the injured area. The other thing is that we want to restore function. How do we restore that function? We want to also include maybe some physical therapy and some rehabilitation, some spinal hygiene perhaps, and we want to regain, step number 4, we want to regain that quality of life and energy to give you the life that you deserve. And all of this is available to you in our complete system. We don't just go and inject somebody if they're not the right candidates. That core 4, we're going to create some customized signature solutions to you. We're going to use some of the most advanced technologies and digital body scans to be able to tell our next level biointelligence body scan that's going to help us determine organs, tissues that need support or help to help regenerate and re-go in the affected area. We might also put you on a food plan, or we will suggest you stick to our dietary constraints to help with the inflammatory process, or at least make sure you're not screwing up what we're trying to accomplish with your healing. So we have a plan that's perfect for you, and some of it may be actually eliminating certain toxins from your body, but we'll figure out the plan that's right for you. And then you have our support, and we want to make sure that you understand our protocols and our systems are the complete package. We're going to remove the cause, we're going to repair, regenerate, and get you back that quality of life you're looking for. But keep in mind, physical rehab is meant to increase that range of motion, flexibility. It increases strength and stability in your condition. So as we're going through that, you can kind of ask yourself, would I rather be doing physical therapy and rehab where it's painful after a post-surgery like a knee replacement, or would I rather be doing that knowing that I'm regrowing and regenerating my own body's ability to heal? You know, so the choice is yours. You always have choices. You want to move forward, we do not want to waste time. You know, we will not waste time. And that's the important piece, is that we don't want to continue to repeat this either. You know, so our next consult is moving forward. And if your spouse or significant other should be here for that, we encourage you to bring them to make the decisions that's right for you. We would then work together to provide you a program that would fit within your budget. So I'm going to give you a gift. And because you watch this, you can look at this and you can kind of think of it as like a $350 to $500 value. We're going to be doing consultations with you and exams. We're going to do perhaps some digital imaging if necessary, some x-rays if possible. We may be reviewing some other orthopedic type evaluations. We're going to review your body pains and your goals. What are you looking forward to doing? You know, what does it look like to be successful? So if we can take you from where you're at and get you into more of that 70 to 90% success, as opposed to where, you know, continuing to stay or get worse. We want to personalize a plan to hit your goal, and we want to give you the support, resources, and tools necessary for you to accomplish that. We want to, again, my purpose is to help as many people as possible, not just get out of pain, but to educate and empower you to get the next level in your health, your happiness, and lifestyle. So just imagine what you would look like and feel like, you know, losing weight, feeling great, enjoying that range of motion, flexibility and freedom, getting out with your grandkids, getting out with your kids, doing the things that you enjoy in life, as opposed to being enslaved by medications, drugs, and surgery. So if you're ready to move forward, we'll see you soon.
Okay, state your name.
I'm Roxanne from Poplar Grove.
Thank you, Roxanne. And where are you in the program?
I'm a couple weeks into the stabilization phase, so I've done the whole first part, and now I'm a couple weeks into it, and then I will be in a couple weeks doing it again.
Oh, all right. And how do you feel about that?
Oh, it's great. It was very fast, and I mean, I worked diligently with the program. I did not cheat at all, but it works.
Do you think it's easy or hard?
For some of my personality, it was easy because I'm very meticulous and structured. So yeah, I found that it was easy. I mean, I lost 40 pounds. I think it's really good, especially for a female.
Of course.
And you know, looking forward to doing it again. I find it really great going upstairs because I lost the weight so fast. My body didn't have time to acclimate, and I was like leaping up the steps. So that was great.
Great. So you have more energy then. Yeah. So what would you tell someone that asked you about the program?
Oh, I think it's a fantastic program. I think it's a healthy program. I think it's really what I was looking for when it was explained to me of what it was. I knew what I didn't want, and that wasn't it. So I knew it would work, and I knew conceptually it would work. So and it did, and
so
I would definitely recommend it.
Right. So you're glad that you did the program.
Oh, absolutely.
All right. Well, good job, Roxanne.
Okay. Thank you.
So what I'd like to do is I'd like to offer you the most precious gift, and that's a chance to have a longer, happier, and healthier life, as illustrated in this video. But you get a choice.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
People don't move forward with care is because, number one, they don't have the time for their health. You know, what I know is this in working with patients throughout the year is that procrastination is the thief of health. So when's the best time to get started? Is right now. You know,